Hi, my name is Juan, and welcome to The Couch, a podcast where real therapists talk about real things. Please remember that we are therapists, but we are not your therapists, and this podcast is intended for educational purposes only.
All right, my friends, you know, you're doing something really amazing. You got your first counseling session, and I think that's something really to be proud of, to hold space for. I do. You're investing in yourself. It's interesting. You think about investments, and as kids, right? Kids, we often teach kids invest money into a bank, right? And it grows over time. And I think that same mentality, same mindset can be applied to the investments you make in yourself, right? Go work with a counselor, read a self-help book, listen to this podcast. It's an investment in you, and you are worth that. Today I wanted to do an episode on what to expect in your first counseling session, because I think sometimes there's a nervousness, there's a worry of this unknown. My name is Dr. Juan Santos. I am the host here of the Couch Podcast, where we talk about mental health. We talk about real conversations surrounding it, relationships, personal growth. I'm the founder of Santos Counseling. It's a local counseling practice in Greensboro, North Carolina. We work remote as well with anyone in North Carolina, the state of North Carolina. If you've been thinking about starting therapy, or maybe right you're on a website, you're on santoscounseling.com, and you're thinking about, I want to make this appointment. I'm not sure what I'm about to get into. Right? You're thinking to yourself, well, do I got to tell them everything? Is this counselor going to judge me? What if I cry? What if I cry in front of them? Right, today we're going to walk through the process of the first session, really to build comfort, to build awareness, so that you can keep moving forward. The first session, it can feel different. First, I want to reassure you of something. Almost everyone feels nervous, and I believe that. I think many of us, right, we feel nervous because it's our first therapy session. We're not quite sure what's going to happen. I've had amazing people sit with me. I've had individuals tell me that they sat right outside of the practice parking lot, right, really thinking about debating, am I going to go in? Right, others I've had shared with me, they made an appointment and they'll come back a couple of years later and then show up and they'll apologize and go, sorry, I should have came that first time. And I go, no, that's okay. It's your journey, it's your process, you're here now. Here's the truth. You don't need to know how and all these intricacies of therapy, how it works. That's our job. That's my job. My job as a licensed counselor is to know how therapy works. Right? Your job is to show up, my friend. That's it. It's to show up as you. Show up with what you've got there in your hands, bringing with you in your soul. The first session isn't about having all of the answers. It's about you and that counselor, maybe you and I having a conversation, right? Getting to know one another. The first session is about getting to know one another, getting to know you. So I want you to do that. I want you to think about your first session like meeting a new primary physician, a new primary doctor, right? They're not immediately going to jump into treatments, right? They're not going to do that. They're going to learn a couple of things. They're going to learn about your history. They may even talk about how it works. And counseling works in that same way. You show up and not right away are we jumping into treatment, right? A effective counselor is going to show up. They're going to go over a few questions. They're going to talk about what brought you to therapy. They may ask about your family background. They may ask about relationships. They may look into what's been happening, the day-to-day and recently in your life. They may ask questions about, your academic background, your school, your work. They may ask questions about your medical history, your goals. Right? I think some people worry that it's going to be like an interview. And it's not like an interview. I like to think about it more as a fun puzzle. And a fun puzzle, I use fun in the way of, it's not a pressure puzzle that you got to solve and know everything right away. It's fun. It takes time, right? We discover things. We're curious. We're non-judgmental. The more we understand about this puzzle, the puzzle being your story, the better that the counselor can help, the better that we can help. And some of you may be thinking, do I need to tell them everything? No. One of the biggest, I think, in my opinion, it's one of the biggest misconceptions about working with a counselor that you have to go into that first session and just spill everything out. No. You don't. You're in control, not the counselor. If I'm your counselor, not me, you, my friend, you're in control of your story. It's your story. And there's some clients that come in and they open up very quickly. There's others that come in and take a little bit longer, but that's okay. Both are completely okay, because you know what? It's your story. I strongly believe that a good counselor won't force you to talk about something that you're not ready to talk about. Why? Because I think trust is like building a wall with lots of bricks. It's not done quickly. It takes time. And therapy moves. And I guess I'm just almost realizing this myself now. Maybe just hearing the words out loud. Therapy moves at a speed of trust, right? Not necessarily a speed of pressure. So look, your counselor won't judge you, right? It's a space of comfort, a space of safety. And I think I get that question often. I've heard stories of individuals where they have very challenging clinical experiences. And I want to share with you that, at Santos Counseling, it's something we work a lot on. We work a lot on teaching the counselors in the practice and collectively showing up in a way where we honor you, we honor your story. And I want you to know that about your first session, that's going to happen in there. It is not a place, and nor is it our role to judge. Our role really is to be curious, to understand. And we're trained as counselors in that way, in case you're curious about that. We're trained to ask curious related questions like, what happened? What are you carrying? What strengths do you hold, do you already have? And then in case you're wondering about the end of therapy, right? The end of that first session, because we talked about what happens in the beginning. As that session comes to a close, right, the counselor typically summarizes a couple of items. They may share some initial observations. You may go into some of the goals or some of the milestones that you may want to reach. They may go into the recommendations of how often to meet or when to meet. It could be a space that you ask questions, you ask items that you may have in mind. And then from that meeting, as it closes up, right, the hope is that you leave empowered, you leave with a couple of new puzzle pieces to that giant puzzle piece of your story. Right? There's no pressure. There's no pressure of I got to have it all solved in one session. No. And I find, and I'll close with this, I find that one of the key ways to get the most out of therapy, especially in preparing for your first session, is holding a level of honesty with yourself. Right? I encourage individuals when they come in as you are. It's okay to say, I don't know. The counselor asks you a question. It's okay to say, I don't know. It's okay to say that. Give yourself grace. Right? If you can have that as a couple of tokens there to help with a treatment process, to help with counseling, know that it's okay to say, I don't know. Know that it's okay to give yourself grace. And please know that growth doesn't happen in one session. Therapy is a process, not a one solution, one quick fix. My final thoughts on that first session is something that you may be thinking about, is finding that right fit. Like, who do I work with? I encourage you to research. One of the things that we do at Santos Counseling is our counselors collectively work on developing themselves clinically, on learning new skills and building new modalities and theories, right? So learning maybe CBT or EMDR or all of these really amazing, wonderful styles of therapy that support in treating individuals. We pull from the research, we support each other through our growth. And then we do that so that when you show up to that first session, you feel that level of support all the way from the bottom up and the top down. So my friend, as you're listening in, if you've been thinking about seeing a counselor, if you've been putting off therapy because maybe you weren't sure of what to expect, I hope that today gave you a couple of answers. I hope that you don't have to have the perfect words. You don't have to have everything figured out. Just that first step, a willingness to begin, a willingness to get started. Seeking help, I'm going to say this as loud as I can, seeking help isn't a sign of weakness. It is not a sign of weakness. It's often, in my opinion, one of the strongest decisions a person can make. So my friends, until next time, you take care of yourself, take care of each other, and keep on, right? keep moving your wellness forward. I'll see you in the next episode.